Dudley CVS has developed its work to respond to the changing economic and political landscape. This is to ensure that the voluntary and community sector is involved in the design and delivery of services that aim to address the most pressing challenges of the day. We now provide services to add value to health and social care. This ensures our sector's contribution to improving the health and well-being of Dudley Borough residents is recognised, and that individuals themselves can develop and fulfil their potential. To do this, Dudley CVS helps people that access health and social care services by listening to their experiences and working with people who design those services to improve them. Dudley CVS also supports unpaid carers to access services and information that improve their quality of life. Finally, our innovative Integrated Plus project helps those most at risk of entering hospital to improve their lives. Here's how we supported, connected and championed almost 5,000 people with health and care and related issues last year.
Integrated Plus supports people aged 16 and over who frequently visit their GP and are at high risk of being admitted to hospital. The project aims to reduce pressure on medical services and improve health and well-being. Integrated Plus link officers help people become more active in their community. Between October 2014 and March 2015, link officers supported 209 people with complex health and well-being needs. 99 of those felt isolated or lonely, 56 were suffering from depression, 51 had a long-term condition, 29 had mental health issues. 83% of people helped were signposted to voluntary and community organisations for support. This shows how our sector is integral to the integrated care model being implemented by Dudley Clinical Commissioning Group, Adult Social Care and Dudley Group NHS Foundation Trust. Here's the story of one of the people we supported.
Meet Jane, a mother in her early 40s. To help Jane and make sure she had the long-term support she needed, the link officer took time to understand Jane and her interests. Jane had a range of health and well-being issues that impacted on her quality of life. She felt she lacked necessary parenting skills and found it difficult cooking food that her children would enjoy, which caused her stress. Jane had money worries, she felt overweight and wanted to lose weight. She also felt isolated and wanted to meet new people. Jane was interested in volunteering but had no way of getting around. The link officer connected Jane to the services and activities that would help her immediate situation and give her long-term opportunities. This included getting Jane onto a positive parenting programme and linking her to volunteering opportunities through the Dudley CVS Volunteer Centre. Finally, Jane got support from us to apply for a free disabled bus pass so that she could access all the services she was connected to. And now Jane has lost weight and both she and her health trainer are really happy with her progress. Her children's school is continuing to support Jane and her children. Jane has also started volunteering at a community centre and is meeting new people. Jane's looking forward to the Get Cooking programme and she's really happy that she can attend all these new activities.
Dudley CVS Carer Coordinator offers one-to-one support, guidance, information and a listening ear to people who provide unpaid care for their loved ones. Contact is made in a variety of ways, including a weekly drop-in service in the main reception of Russell's Hall Hospital. Referrals are also made from hospital and community staff within Dudley Group NHS Foundation Trust. Contact with carers, relatives and visitors is also made during the tea and chat service, which aims to identify hidden carers. This weekly service is run in collaboration with Healthwatch Dudley and trained hospital volunteers. They offer visitors a drink, a friendly chat and the chance to find out more about the help, support and benefits that carers can access. It is part of the Dudley Group NHS Foundation Trust charity and is funded entirely through donations.
This year, the Carers Coordinator supported 707 carers. 505 were individuals and 101 were in couples that were caring for each other. 214 wanted support with caring issues. 146 needed help with benefits, debts or wills. 117 had long-term physical health challenges and 15 required support accessing health and social care, care homes and other information. Here's the story of Herbert and Grace, a couple supported by the carer coordinator this year.
Herbert and Grace were a married couple that care for each other. Grace had had cancer, followed by several operations. Herbert had been Grace's carer until his stroke, which affected his speech and mobility. Grace then became Herbert's carer. Grace and Herbert needed lots of reassurance when they first met the carer coordinator. They had forms that they couldn't complete, and they thought they wouldn't be entitled to benefits or support. Herbert and Grace valued their independence, but were only leaving home for medical appointments. The carer coordinator helped the couple by reassuring and listening to find out more about what Grace and Herbert felt would improve their lives. We connected Grace and Herbert with Dudley's CAB Care and Disability Advice Line about benefits they could apply for. They were also linked with Dudley Carers Network, and Herbert was referred to an Integrated Plus link officer to encourage him to access activities and enable Grace to have time to herself. Finally, the carer coordinator supported Grace and Herbert to apply for Ring and Ride and make a successful Blue Badge application. We worked with CAB to get them a home visit for a joint assessment, and they were helped to make a successful application for a one-off direct payment of £300, enabling them to take a holiday. And now, Grace and Herbert said that this support has made a tremendous difference to their lives. Grace said that they could take taxis instead of relying on their daughter for transport, and that they were about to take their first holiday in 5 years, giving them something other than medical appointments to look forward to.
Health Watch Dudley listens to local people and involves them in the decisions that are made around health and care. Dudley CVS holds the contract for Health Watch Dudley, and the service has its own team and independent decision-making board. Health Watch Dudley has representation in more than 25 decision-making arenas, including the statutory seat on the Dudley Health and Wellbeing Board. This helps to ensure that decision-makers know, understand and respond to the experiences of people that access health and social care services. Last year, Health Watch Dudley staff and volunteers engaged in more than 3,000 conversations with local people and produced evidence-based reports from what they've heard.
Health Watch Dudley also supported members of Dudley Youth Council to do their own research into the health experiences of 300 young people. The young people presented their findings to Dudley's Health and Wellbeing Board and received feedback from Dudley Clinical Commissioning Group. The report would inform reception staff training to remove barriers for young people. We also surveyed 800 people who shared their views about how they access local pharmacy services. The resulting report contributed to the development of the Dudley Pharmaceutical Needs Assessment, which will influence the development of pharmacy services. Finally, Health Watch Dudley grew the Dudley Information Point Network.
The Health Watch Dudley team has been key to introducing the Community Information Point Network. In partnership with Dudley Citizens Advice Bureau and Dudley Council, Health Watch Dudley has trained more than 150 information champions to provide signposting to health, well-being and care services, or help people to understand where to go for benefits or debt advice. The network includes cafe owners, local authority staff, pharmacists and community volunteers who are all working together with one objective: to prevent crisis. 2 organisations that came on board as information champions, Castle and Crystal Credit Union and Coffee Cups Cafe in Halsowen. Castle and Crystal Credit Union is a community bank serving Dudley Borough and Worcestershire. The ethos behind the Community Information Point Network was a good fit for the credit union, which often gets asked about money management and debt. Castle and Crystal has benefited from being able to access useful resources it can use to support its members. Coffee Cups is a community cafe in Halsowen. It's part of Hallis Homes, an organisation that supports adults with learning disabilities. It made perfect sense for Coffee Cups to join the Community Information Point Network, as the cafe was already registered as a safe place. Safe Places is a scheme that gives vulnerable people a place of safety if they need it when they're out and about in their local community.
The cafe is also very busy with lots of regular customers, so becoming an information champion meant they could make an even greater difference by helping people to access services that will improve their lives.
These audio recordings were done in partnership with the Black Country Talking newspaper, based at the Mary Stevens Centre in Stourbridge. It's a service that brings information to people living with sight loss in the Dudley Borough free of charge. For more information, please contact the Black Country Talking News on 01384 440 333.